Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
I want to get to Taryn, who we love, says how to teach pronouns. This is one of my favorite questions.
Well, and it depends, Taryn, if you're asking about personal pronouns or possessive pronouns, because they're two different lessons. So if you're trying to have the child say I, you, he, she, those are personal pronouns, we, they, all that. Or if you're looking at my, yours, his, hers, that's possessive. And there are different ways to do that. But generally, to give you guidance on that, what we would do is we would pair the name of the person with the pronoun in the sentence. It's a very interesting thing. This was one of the very first lessons that we ever did. And it works, and then you fade out the name. So in other words, it would be like touch my nose, and that would be very confusing for the child because they touch their own nose, thinking that my always refers, but then you would say touch my Doreen's nose, and that's easy, and then you gradually fade out Doreen, and you say touch my Doreen's nose. And then that way, gradually, the child learns whenever they hear touch my, it is someone else's. But when they want to express their own, it's theirs. So across the pronouns, it's always a matter of pairing the name with the pronoun and then gradually fading volume on the name.
Yeah.
It's a little bit, and then when you do it with like visuals, you can also do, with words, and then you fade out the word. It's hard.
Seems so difficult. And yet, what you're describing absolutely works, and it works, takes different amounts of time for different people, so you got to be patient with it. But it's like a magic trick. And then eventually they get it, and then they have it forever, and you can't take it away from them.
Right. But the confusing, his and her are easier, but the confusing part is when you're dealing with my and your, because it reverses if it's reverse or if it's receptive or expressive.
Yes, and it can be overwhelming, but follow what she said, it works. Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.